coming up. Inside one of the most bombed and besieged regions, hundreds of thousands of tons of waste rot on roads and pathways.
Thousands of people got skin conditions.
And as a concoction of human waste and toxic chemicals seeps into Gaza's water, a public health and environmental crisis unfolds.
We don't have the abilities or the resources to solve this crisis right now.
And
things are not improving climate-wise. The sort of global trend is bad.
as planetary systems disintegrate, so too can our mental health.
How does someone manage a fear of something horrible or deadly that they strongly believe or know will happen?
We look at how the human body responds to intensifying climate threats, from eco-anxiety and grief to thoughts of self-harm and worse.
So you would then be able to argue that it's a sign of mental health that we would get more worried. And I would in fact worry about the people that weren't worried.
It's the most consequential just 2 degrees yet. Now,
Climate anxiety is felt by people who care about the climate crisis. You are okay if you care about this. You should be proud that you care.
I think I love you. This is Gaza, a stretch of land that once contained hundreds of thousands of homes and businesses, now utterly unrecognizable. The last 2 years have been some of the toughest for people there. Many have lost their moms, dads, sons, daughters. They've been through a hell that very few of us can understand or even empathize with. Analyzing the environmental costs of the war seems a bit insensitive, but the enclave's waste management system, or lack thereof, is contributing to the crisis and making people sick, compounding an already life-threatening situation that comes with the Israeli bombs and indiscriminate gunfire.
Gaza's displaced live in rubbish. Waste mountains release toxic gases that threaten public health and the environment. 80% of the city's heavy and medium-sized vehicles used to collect garbage and maintain water networks were destroyed during Israel's assault.
مع عودة النازحين وازدياد كميات النفايات المتراكمة في المدينة نخشى من تراكم النفايات بشكل أكبر خلال الفترة القادمة، وبالتالي ستشكل هذه المكبات الموجودة وسط المدينة، سواء كانت أرض فراس الموجودة وسط المدينة أو محطة الترحيل الموجودة.
Despite the ceasefire, Israeli forces continue to restrict access to Gaza's main landfill, and machinery to help manage the problem is being blocked. The municipality says those who negotiated the ceasefire must pressure Israel to remove these obstacles.
حتى تستطيع الطواقم ترحيل النفايات المتكدسة وسط المدينة إلى المناطق الشرقية والتعامل معها والتخفيف من الأزمة البيئية والصحية الموجودة نتيجة تراكم هذه النفايات.
On top of that, 75% of Gaza's wells and its sewage network have also been destroyed or damaged. Sewage is seeping into the sea, harming local ecosystems. It's also leaking onto the streets, contaminating schools, shelters, and hospitals.
ازعاج وخوف للأطفال، وقلنا غير الأمراض اللي حتنتشر. إحنا لسه في فصل الشتاء، هيجينا فصل الصيف، نزلات معوية هنلاقي، غير الحك اللي بتيجي في الجسم وأمراض جلدية كبيرة وما فيش علاجات.
Gaza's municipality is no stranger to crisis management. Despite the enormous challenges placed by Israel's 17-year blockade of the Strip, which restricts the flow of essential goods, fuel, and people, workers have been able to navigate emergencies like the COVID-19 pandemic and other Israeli attacks. But this time was different. Like most of Gaza's residents, the municipality's employees were displaced several times. This weakened the operational capacity of the staff, causing further misery.
واحنا نناشد كل المؤسسات الدولية والجهات الراعية للاتفاق انه نحاول تمكننا كبلدية من الوصول إلى المكب، لأنه هذا أمر خطير للغاية، وإحنا قربنا في المكب المؤقت في منطقة فراس على الوصول إلى الذروة القصوى وعدم قدرتنا على استقبال أي نفايات جديدة في المكب المؤقت.
There are hundreds of thousands of tons of waste on the streets, people including children exposed to sewage. Some people live near rotting trash. Reports are Gaza's 3 main landfills are not operational. So any waste that is removed, where does it go exactly?
To be honest, I don't think the pictures from Gaza will really explain the massive crisis that we are facing daily in Gaza Strip. We are talking about a massive destruction in the infrastructure, in the municipal resources, and that's led to many environmental and health crises and catastrophes. One of them was the accumulated waste among the city. We are talking in Gaza City itself, there is more than 170,000 tons of waste in Gaza City, while double or triple that amount in Gaza Strip. And this is, of course, lead to many health problems and could lead to long-term health impact also. And the municipal teams and municipal crews, they don't have the abilities to solve this issue. One of the main reasons and the challenges for us is that we don't have enough machinery, especially vehicles and heavy vehicles, to collect and to remove that. With note that Israel has destroyed 80% of our total medium and heavy vehicles in Gaza Strip. So we don't have that resources. And also the main, another main challenge for us is that we don't have access to the main landfill in the east of Gaza. From the first day of the war till now, we don't have access to that landfill. So we now collect some of that accumulated waste to a makeshift landfills, unhealthy, unprepared.
Yeah, for sure. And lots of the trash that remain in the streets in the cities, I understand when water passes through it, it creates something called leachate, which for our audience is when water filters through layers of human waste and toxic chemicals, then it gets into surface and groundwater. And of course, in that, bacteria, parasites, viruses can thrive, affecting people, many kids. How do Gaza's municipalities even begin to deal with leachate?
Leachate is one of the most dangerous materials that could lead to poisoning, to many diseases, to long-term health damage, not only toward the humans, which we already see in the statistics of the Ministry of Health, that they confirm that thousands of people got skin conditions, stomach illness, and a lot of other disease, especially in the children and among the children. But also one of the dangerous long-term impact that this leachate could leak to the groundwater. And Gaza's groundwater already polluted. It's not even drinkable water. So with more, pollution, this leach is now going down to the groundwater. And we don't have the abilities or the resources to solve this crisis right now. We sent our needs to the international organization, to the United Nations organizations. We list everything that we need to solve the crisis in Gaza. And one of them was the waste crisis, the accumulated waste in Gaza. We asked for heavy vehicles, we ask for trucks, we ask for sufficient amount of fuel.
In addition to what you just mentioned, the machinery you need, I know like the Union of Gaza municipalities, Gaza Strip municipalities, has been asking for solar energy systems and maintenance materials to prevent leakage, sewage from leaking onto the streets. In addition to what you mentioned, machinery to clear the 55 million tons of rubble that are still there exposed to the public. Has there been any progress on those appeals for help?
We got a lot of promises, actually, before the ceasefire, and in the last few weeks also we got more promises that we will, the NGOs and the international organization promises that they will provide us with our needs to start the, figure out what to do with this crisis in Gaza. And unfortunately, till now, we don't have the minimum of our needs, till now, and zero machinery till now. There is 100,000 meters of the water network has been damaged. There is 175,000 of the sewage network in Gaza City. These numbers only in Gaza City. So you can imagine, how big the damages among the Gaza Strip at all.
For people looking on, how would you want us to help you?
This is a very important question. We believe that there is a lot to do to help people. Now, people in Gaza, they need food. People in Gaza are getting less than 20 liters daily. This is for all the human needs, like drinking water, showering, cooking. Heavy vehicle is an essential need for us. It's not only to collect and transfer waste. We needed to open the closure roads. That's already 70% of the roads and the streets in Gaza, partially or totally damaged. So we need the heavy vehicles for all of our basic services and for of our work. And without it, and without sufficient amount of fuel, we will not be able to alleviate the suffering of people. So we call for an immediate help, an immediate providing with our needs from the people, from the NGOs, from the governments, from the United Nations organizations, because we need to do our job. So please help us to do our job.
What does existence mean to you? Why do we go to school, get a job, start a family? On the most basic level, you and I probably want the same thing: a home, a car, travel the world, be healthy and have healthy people around us. But achieving our goals is becoming an increasingly daunting endeavor. And in the age of globalization, many of our lives are entwined, and so are the challenges: the cost of food, transport and housing, the trade wars and regional conflicts, ongoing battles to define what a society should look like, confrontations based on religion, ethnicity and gender, and of course, climate-related risks. But in all of this, how does one maintain good mental health? Let's look specifically at the climate crisis. Scientific research is linking high temperatures, pollution and desertification to higher rates of self-harm and worse. I must warn you firstly that this segment contains the topic of suicide and its potential risk factors.
When we talk about the fear of environmental disaster, eco-anxiety, you've written quite a bit about this. Are we talking about, is there differentiation between people who are actually exposed to disasters, or does it refer to people who don't necessarily live or exposed to them, but are just emotionally invested in the issue?
So I think it's, you know, basically everybody's impacted somehow, just some much more directly than others. But yeah, I think in a way it doesn't make sense to separate it, like people who are impacted and people who aren't, because we all are.
How does someone manage a fear of something horrible or deadly that they strongly believe or know will happen?
It seems that people do it really, really differently. And that's the sort of, I don't know, interesting, unsettling thing about working with people with eco-anxiety or climate grief, that, you know, some people go into denial, some people go into kind of manic, trying to do something. Some people get depressed. Some people are just constantly anxious. Some people don't sleep. It just manifests itself in so many different ways.
Considering our trajectory in terms of worsening climate-related disasters, does it ever go away, climate anxiety?
That is such a good question, because the thing that seems very interesting and weird about it is that, I mean, you know, things are not improving climate-wise, that, you know, the sort of global trend is bad, but individual people's eco-anxiety definitely comes and goes. Like if you have a problem in your relationship, it might really show up as kind of apocalyptic fears of societal collapse. Or so you have to keep an eye a bit on yourself. Like if you're really, really having a lot of bad thoughts, ask yourself, is it definitely that? Or is it, you know, because you've just had a row with your mum? Or, you know, to really just to look after yourself in that way.
What is the connection between eco-grief and eco-anxiety? When I think of grief, I think of something bad has already happened and you have a sentiment about that after the fact. What's the connection?
That's a good one as well. People argue about the terms, like what should we be calling this thing? And eco-anxiety gets used just because that's the one that sort of took off as a search term on Google. But lots of people in the movement and in the kind of psychology realm think that climate grief is better because it takes into account that this is a real thing that's really happening, that we've already lost a lot and we're going to lose more, whereas anxiety sets it in the future, which maybe isn't a good message to be sending given that it's already happening.
When you look at, for example, the climate crisis, which is what this program is about, we've been seeing reports of people committing acts of self-harm or having thoughts of suicide when it pertains to the climate crisis. Can you connect that bridge between mental health and thoughts of suicide, which is an incredibly complicated topic, as it pertains to the climate crisis?
So I am working in clinical practice with people who self-harm or who can feel suicidal because of the climate crisis. So I have direct experience of doing this work clinically as a psychotherapist. Mental health difficulties in response to the climate crisis is a sign of mental health, not a sign of mental illness. So although your emotional response may be to feel distressed, anxious, depressed, hopeless, despairing, that is a sign of mental health. Let me explain that. We measure mental health by looking at our capacity to respond to external reality. And when we look at external reality in relation to the climate crisis, things are getting worse. Things are getting worse all the time. And collectively around the world, we're not taking action to resolve the climate crisis. We're actually doing the opposite. So drilling for more oil, not worrying about the ice melting, wildfires, that is all incrementally increasing. So you would then be able to argue that it's a sign of mental health that we would get more worried. And I would, in fact, worry about the people that weren't worried. I would think, how are you doing that? How are you defending against that? Why are you not anxious? And it's because they're focused on the wrong thing. So they are defended, they are deflecting, and they have denial around the existential threat to humanity, which protects them from climate anxiety. So climate anxiety is felt by people who care about the climate crisis. It's an indication they care. Instead of labeling them as mentally ill, we should be proud that there are people that care. Not everybody feels the same level of anxiety about the climate crisis in the same way. Some people are very, very anxious and they find it very hard to manage those feelings. Other people are much more defended and they believe things like technology will save us. You know, we can just invest in X, Y, Z and we'll all be all right. Humanity has faced loads of crises before. We'll deal with this. They can reassure themselves with that. Other people cannot be reassured. So we're not all the same in the way we face this. Frequently, young people are less easily reassured because their whole future is in front of them. And they're looking at their future and thinking, well, how am I going to cope with this? So when we're thinking about people feeling it to the extreme end of hurting themselves, self-harm, suicide, it's not that they are weak. It's not that there is something wrong with them. It's just they're feeling it more. And they're also feeling that the people around them don't care. The young people I've spoken with who are suicidal say, it's not that I want to die. They say, it's just that I don't know how to live in a world that doesn't care about the future of young people. So when you think about climate anxiety and distress, it begins with climate change. Of course, we're scared of that. We should be. But then, particularly for young people, it develops into something else, which is the people in power, the people with the power to change this are doing the absolute opposite. So then young people are left feeling abandoned and betrayed and hurt by people in governments, people running oil companies who are not acting to protect them. So their climate distress and certainly the suicidal feelings and self-harm are caused by relational distress, not just fear about climate change.
For those who care about the climate crisis and are at that point or approaching that point where they can self-harm, what kind of coping mechanisms can you recommend?
So the number one recommendation is don't feel this alone. People will understand you. And if some people don't understand you, find people who will. In the research that we published in 2021, we researched 10,000 young people in 10 different countries around the world. This is also important to know you're not alone, actually, because it's that alienation and isolation and feeling that you're alone that can make things just feel, well, there's nothing else I can do. Hurting yourself comes from a place of powerlessness. So get empowered, but do that in relationship with other people. Find people who do care. 3/4 or more of this 10,000 young people, I'll send you the link to the research, told us the future was frightening. This was 75% of young people told us the future was frightening, and over half thought humanity was doomed. So this is what young people are thinking. It's not just how you feel, it's also what you think. So we have to address both how you feel, anxious, afraid, but also your thoughts about the future. The worst statistic was that 48% told us they were dismissed or ignored when they tried to talk about climate change. So that we could do something about today. Do not dismiss and ignore young people when they try and talk to you about climate change, even if you do not feel the same. Tell yourself it's okay to feel this way. It's okay to not be okay. Because how else would we feel at the moment, right? It's healthy to not feel this way. Remember resilience. Resilience does not mean everything going well all the time. Resilience means things go okay, then they go badly, then you pick yourself up and you try again. And then they go badly again, you pick yourself up, you try again. Then they go well, then they go badly, pick yourself up, try again. Do not lose heart. We need courage, we need community, we need to join together with other people who care. And do not internalize this and think there's anything wrong with you. You are okay if you care about this. You should be proud that you care. And you have to talk yourself through that.
If you or someone you know is struggling with suicidal thoughts, please don't hesitate to reach out to one of the helplines below. If someone is in immediate danger, call your local emergency number right away. You are not alone, and support is available. Help is just a call away.
We began this episode on the Gaza Strip, and we'll leave you with images from there. The resilience of the Palestinian people is truly remarkable. Despite inhospitable circumstances, hundreds of Gazans are sharing meals every evening during Ramadan. Their unwavering spirit is a powerful testament to their resolve.